Hello, everyone. It is Friday, not night, live. You get out of the habit of doing this, and then it's just really hard when you come back. So, when I was doing it every Friday, I got kind of accustomed to it, right? It's pretty easy. You push the button, you go. I haven't been doing it a lot, so it's a little uncomfortable. I wanted to come on today and talk to you a little bit about the federal employees' health benefits or health insurance and also Medicare, because that is the number one question that I get from people in my classes. When they're 65, do they have to get Medicare? How does Medicare interact with their health insurance at work? So, since I answer that question all the time, I figured it might be a good idea to make a video of that I could then share with people. I'm Debbie Hatch, if you haven't met me before. I am the owner of Pinnacle Personnel Services, and what I do for work is teach federal agencies about their retirement and about their benefits. So this past week, I have had 3 classes, 2 covering retirement and 1 covering insurances, where we talked about all of this. But because I've also had a couple of friends reach out to me, some family members who have recently retired reach out to me and ask me this question, again, it just seems to be something that we should talk about and be able to save in video format. The health insurance through the federal government can be really confusing for a lot of people because of the number of options that we have. There are over 260 different health insurance plans available to federal employees across the country. So trying to research 260 things is really overwhelming. If you stop for a minute and consider the 3 kinds of insurance that we have, that will help you to limit your research. We have fee-for-service plans, health maintenance organizations, and high deductible health insurance plans. Fee-for-service plans generally give you the most flexibility. You can go wherever you like. You have a copay, you have a deductible. But because they do give you so much flexibility, they generally cost a little bit more than the health maintenance organization types of plans that we have. HMOs are through negotiated contracts with various insurance companies. Generally, they're going to limit who you can see. You have to see the doctors within your approved network, or you're hoping to get a referral from your primary care provider. Or if you go outside of that network, then you need to know that you're going to be paying a little bit more out of your own pocket. The third kind of insurance that we have is a high deductible health insurance plan. This one is for people that don't go to the doctors very often, so the premiums are very low, but when people do go to the doctors, then their deductibles are substantially higher than with the other plans. One of the benefits, though, of having the high deductible health insurance plan is that with that, and only if you have that, you could also participate in something that's called a health savings account, or an HSA. That is different than an FSA, or a flexible spending account. One of the big differences, and I'll get into some of the slides with you in just a second, is that flexible spending accounts are normally use or lose. There have been some exceptions to that over the last couple of years because of COVID. But generally, when I do an FSA and I get to the end of the use period, if there's still money in my account, then I forfeit that. That doesn't ever happen with a health savings account. That money is yours. You get to keep it from year to year. And as long as you use that health savings account money for medical expenses, then you don't ever have to pay taxes on it. So again, big difference when it comes to that. If I pick the fee-for-service or the HMO or the high deductible health insurance plan, then I can just go to the Office of Personnel Management's website during our annual open season, which runs from the second week of November through the second week of December. Doesn't matter if you're working or if you're retired, you're going to still have that same open season. And then you can just look at the plans under that type instead of all 260 things to choose from. You choose the type, you choose the plan, you choose who to cover. You can do a self only. You can do a self plus 1 qualified family member. That might be your spouse, or it might be a child up to the age of 26. Or you could do a self and family. Because we do have an open season every year, you can change plans every year if you want to. If you have changes in qualifying life events, something happens to your insurance, to your employment, or to your family status, then you can make changes even outside of that open season. There's a lot of flexibility. When we talk about going into retirement, if you want to keep the federal employees' health benefits, you must be enrolled in any of the 260 plans in any combination whatsoever 5 years before you go into retirement. And it does have to be that 5 years leading up to retirement. I can't come in as a federal employee, get it for 5 years, cancel it, and then think I'm good to go. It's got to be that last 5 years before retirement. But it is any plan, so if you've changed plans, as long as you've had one of them in effect at every period of time for the last 5 years, you're good to go. Anyone's plan can give you that 5-year coverage as well. We have many federal employees who are married to other federal employees, and they believe that 5 years before retirement, they can't be on their spouse's insurance anymore. They now have to get 2 self-only policies. That's not true. Your time on another federal employee's plan, your time on your own plan, any of the plans, any combination for 5 years, you can keep this insurance. For those of you who are military veterans, TRICARE counts as a federal insurance as well. So does CHAMP VA. So if you're covered under the military insurance, you don't need to get FEHB 5 years before retirement. Your TRICARE is going to count for that. You would, though, if you want the FEHB, have to get an actual FEHB plan in place just prior to retirement in order to be able to keep it. The high deductible plans, as I said, they do have a higher deductible. It's $1,400 if you're enrolled in a self-only plan this year, and it's $2,800 if you're enrolled in a self plus one or a self and family. You can see that the out-of-pocket cost can be pretty substantial with these high deductible plans as well. But as I said, the value of doing that, as long as I'm not going to the doctors very often, I have those lower premiums, I can also contribute money to a health savings account. It's coming out before I pay taxes. It's invested, so over time that pot of money is growing and it's sitting there for me. Remember that it's mine for the rest of my life. I can use that for any kind of medical expenses, and as long as I do, then I don't have to pay taxes on that. It is mine. So I can use that money for any purpose, but if I'm using it for something that isn't health related, I do have to pay taxes, and depending on my age, there's potentially a penalty that comes along with using that for something that's not medically related as well. The amount that I can put into my health savings account does change pretty much every year. I won't say it always does. It's up to the Internal Revenue Service, but generally it does. So for this year, if you have a high deductible plan, you can put up to $3,650 into an HSA if you have self-only. And you can contribute up to $7,300 if you have a self plus one or a self and family. If you are over the age of 55, you can put an additional $1,000 into your health savings account on top of those normal stated amounts. One of, this is my opinion, most tremendous benefits that our federal employees have is access to this health insurance. Not only do we have a lot of things to choose from, not only is it excellent insurance, but the federal government pays 72% of the weighted average cost of the health insurance. We do that for people that are working for the federal government. We do that for people that retire from the federal government if they carry the health insurance into retirement with them. So you can see on my slide here the amount that the government is paying bi-weekly for employees. Now, when I retire, if I keep the insurance, the government still pays the 72% weighted average for me, but my cost is going to change a little bit for a couple of reasons. While I'm working, I'm paid bi-weekly. I normally have 26 pay periods. When I retire, I'm paid monthly. Essentially, I'm only going to have 12 pay periods. Another reason that it changes is because as long as I'm working, I have something called premium conversion. This law passed back in October of 2000, and it allows me to pay for my health insurance before I pay any taxes. You didn't have to sign up for this. Happened automatically. We enrolled everyone at the time and everyone that's been hired into the federal government since. Premium conversion does not go into retirement. So as long as I'm working, I'm getting my paycheck, I pay for my health insurance, and I only pay taxes on what's left over. Whereas after I retire, I get my retirement, I pay taxes on it all, and then I pay health insurance with what's left over. So again, that's why it's changing, but the government is still paying the 72% weighted average cost, just like they always have. Because premium conversion gives me that tax benefit, it also limits me to being able to change anything with my health insurance to that annual open season. If I opted out of premium conversion, I could make changes at any time. In all of the years that I've been helping people understand their retirement and benefits, I have met two who opted out of premium conversion. Most people understand the tax benefit and they are in, but then we can only make changes during open season unless we have a qualifying life event. So like I said, something happens with my employment, something happens with my family, something happens with my other insurance. Maybe I'm carried on a spouse's insurance and they retire and they lose access to their insurance or something, and therefore I lose access to insurance. Those are examples of qualifying life events. And if I have one, then I am allowed to make a change to my health insurance even outside of open season. Now, like I said, the biggest question that people have about this is generally, how does it interact with Medicare? Medicare is something that we become eligible for normally only once we're 65. Some people qualify a little bit sooner if they're getting Social Security disability, if they're receiving a widow's or widower's benefit from Social Security, or if they have very specific illnesses. But usually, we don't qualify for Medicare until we're 65. So there are 4 parts to Medicare. That is not just one thing. And how that is going to interact really does depend on where I am in my federal career. So the slide that I have up right now, you can look at the left-hand side. This is while you're working. It doesn't matter how old you are. If you are working, or if you are retired but you're under 65 and therefore not yet eligible for Medicare, then the federal employees' health benefits remains your primary insurance. Let me say that again. As long as you're working, it doesn't matter how old you are, your federal employees' health benefits remains your primary insurance. When Medicare becomes a question is once I'm on the right side of this slide, and 2 things are both true. I am now retired. Also, I'm 65 or older. So now you see that FEHB becomes a secondary insurance. Talking about the parts of Medicare. My computer just had a glitch. I'm not really sure what's going on here. Talking about the various parts of Medicare. Part A, the Social Security Administration calls hospital insurance because Part A covers inpatient care. It also covers hospice. There is not a premium for Part A. We pay for that while we're working. We have a payroll tax that equals 1.45% of each of those paychecks to cover Part A. It does have deductibles and it has coinsurance, but it does not have a premium. We pay for that as a tax from our paycheck. Medicare Part B has a slide by itself, so I'm going to talk about that one in just a minute alone. Part C is Medicare Advantage. This is Medicare through private insurance companies and various groups like AARP. This is the kind of Medicare that we see advertised on television. It's the kind of Medicare that sends us mountains of junk mail when we are approaching age 65. Have a look at that. If you see something that's interesting, maybe you're going to opt for Medicare Part C. However, if you have any of the FEHB plans or you have TRICARE through the military, you don't need Medicare Part C. If you have any of the FEHB plans or TRICARE through the military, you also don't need Medicare Part D, which is the part of Medicare that takes care of prescriptions. We pay a different amount for that depending on where we live and depending on the kind of scripts that the doctor has written for us. But like I said, if I've got the FEHB or TRICARE, I don't need Part D because what I have already is considered comparable coverage. So on this slide, the first three parts, right? A doesn't cost me an additional premium. When I'm 65, I may want to go and sign up for that because I'm finally old enough to get a benefit for this thing that I've been paying for however many years that I've been working. C, don't need it if I have another insurance. D, don't need it if I have another insurance. B is the big question mark because that's the one that has a monthly premium and it can be substantial. The minimum premium for this year is $170.10. That is per person, that is per month. And so that means that if my spouse and I are both over the age of 65, we can multiply that number by 2. Remember I said that's the minimum. So you can look at this chart and see, depending on how much money you made and reported on your income taxes, generally 2 years before you sign up for Medicare, they set your rate based upon your income. That's called means testing. So if I make above certain amounts, I'm going to have to pay more than my $170.10 a month. When I'm 65, if I'm already collecting Medicare, then my Part B premiums can come out of my Social Security. I meant to say if I was already collecting Social Security, not Medicare. Once I'm 65, if I'm already collecting Social Security, my Medicare premiums can come right out of that. If I'm not already collecting Social Security, then they bill me for my Medicare. Quite generally, that's done quarterly, although I could ask them to do it monthly. Okay, so then the logical question is, oh my goodness, do I have to get this and start paying an extra $170 a month or whatever it is for me out of pocket? When you ask the question in that way, do you have to? The answer is no. It's optional. However, there's a lot you want to know before you decide to opt out of Medicare Part B. Number one, if you are a military veteran or family member and you have TRICARE, that becomes TRICARE for life at age 65. TRICARE for life does not have a monthly premium, but will require you to enroll in both Medicare A and B. So if you have TRICARE, there's your answer. Yes, you have to. It's a TRICARE rule, though. It's not a Medicare rule. If you don't have TRICARE, you have FEHB. Be aware that the HMOs and the fee-for-service plans act differently. For the fee-for-service plans, they have a right to act as though you have Medicare once you're eligible for it, whether you have it or you don't. So if you choose not to get it, and your insurance company is pretending that you have it, you may find that you're paying a lot more out of your own pocket. That's definitely something to be aware of. With the HMOs, they're all different. Remember, they're through negotiated contracts. So what you need to do is take a little bit of time to go to the Office of Personnel Management's website, pull up the Federal Employees Health Benefits Plan that you're enrolled in, and read your book. Every one of these plans is required to have a section that tells you how it will interact with Medicare. Once I hop off the video, I will drop a link for the Office of Personnel Management's website in the first comment, so you can simply scroll below, click on that, and it will take you right to the website. You can start doing a little bit of research for yourself. Okay, so do I need it? No, but if I don't get it, I may be paying a little bit more out of my own pocket for a period of time. I have to decide if I want to do that or not. The other thing I have to be aware of is that if I don't sign up for Medicare Part B at what the Social Security Administration calls my earliest opportunity to enroll, but I sign up for it later, there's a potential penalty that's waiting for me. And that penalty is cumulative. It's also permanent. So what's the penalty? 10% of every year that I opted out of Medicare Part B when I was eligible to be in the program. Here's an example. Let's say that I am 65, I am already retired, I don't have TRICARE, I've just got an FEHB plan. I didn't get Medicare Part B, I heard it was optional, I'm just going to rely on my FEHB fee-for-service plan. I'm okay paying out of my own pocket every once in a while because I'm healthy. I don't go to the doctors very often. 5 years from now, unfortunately, we don't get more healthy as we age. I'm going to the doctors a lot more often. I'm paying a lot more out of my own pocket. I give up. Fine. I'll go sign up for Medicare now. Well, I got to wait for their open season. It does run from the 1st of January to the 31st of March each year. If I sign up in the open season, it doesn't become effective until the 1st of July, and it is if I sign up in the open season that I have that 10% per year penalty waiting for me for every year that I wasn't in. So if I took care of myself for 5 years and now I go sign up, my premiums are going to be 50% higher than anyone else's for the rest of my life. I have to decide whether I'm willing to take that chance that I'm not going to enroll later on. So there are actually 3 periods of time when a person can enroll in Medicare Part B. 2 of them have no penalty. It's only if you sign up in the open season that you have that penalty. So the first thing we have is something called your initial enrollment period. This begins 3 months prior to your 65th birthday. It includes the month of that birthday, and it continues on for 3 months after that birthday. If you sign up in that initial enrollment period, there's no penalty. If you have TRICARE, it will expect you to sign up during that initial enrollment period. If you don't have TRICARE and you're not working, then this may be when you decide to sign up. Again, it's up to you. I'm telling you the things you need to think about, but it's up to you. Now, if I'm working, it doesn't matter how old I am, remember that my FEHB remains a primary insurance. So I don't need to sign up when I'm 65 if I'm still working. But we need to be clear on what this means. It doesn't matter where you're working. It doesn't matter how much money you're making. What matters is where your health insurance is coming from. So we have something called a special enrollment period. That's the second part of this slide. And it says, if you are 65 or older and you have group health insurance that is based upon your or your spouse's current employment, you can wait up to 8 months after you leave your job, no matter how old you are, to sign up for Medicare Part B. And as long as you do sign up during that special enrollment period, you don't have the penalty. Okay? So what's important is, where is my health insurance coming from? Here's the example I like to use in my classes. If I'm working for the federal government, my spouse is already retired. He doesn't have TRICARE, just has the insurance through me at work, and he's already 65. He doesn't have to enroll in Medicare Part B because he's covered on my Self Plus One active employee plan. And no matter how old he is, he could be 92. When I stop working, as long as he enrolls during that special enrollment period, he won't have any kind of penalty. But if I switch that around a little bit and I say, I'm still working, even if I'm working for the federal government, but my husband's already retired and he's now carrying the insurance, not me. Now the insurance is no longer based on my current employment. It's based on my husband's retirement. Now when I turn 65, my clock has already started. Initial enrollment period, unless you're still working at 65 with insurance at work, then you can wait for the special enrollment period. If you don't sign up during either of those, then you're looking at that annual open season, which runs from January to March of every year. I have in the slides, and I'm going to leave this up here because I've been sitting at home this whole time. My phone doesn't ring, but the second I get on the video, I've got 14 different calls that are coming in. I want to have this slide up here so that you can freeze the video and get some information for yourself. It tells you if you sign up for Medicare at this point, here's when it's going to become effective, because that's really important for people to know too. I went a little bit long on this one. I feel okay about it because I haven't been on here every Friday, and this is a really important topic. If that was really quick, if you have any questions, don't hesitate to drop them in the comments. Remember, I'm going to put OPM's link down there so you can look at your health insurance. But let me know if you have any questions, if something's not clear, if you want some clarification. Let me know too if you have other suggested topics that you would like for me to cover in a video. I'm always happy to hear suggestions that other people have. Have a great day. Take care of yourself. And hopefully this is something that you can use and that you found helpful.